Very good. Thank you. So I think what we'll do is we'll head into the specifics of the study. If you have any questions for Bill, I know that there are a lot of very refined points, I guess, that he's made about how we protect information, and it could be confusing if you haven't done this before, how to stay within our guidelines and the legal processes. So please feel free to contact Abby or Bill or myself at any time to get further information. For those, there have been quite a few forms associated with these studies, and I know that it can probably be confusing after a bit when you see so many forms coming your way. Okay, so before I go on into the study, I do want to mention a few other people in the room here with us. And I'd like to introduce Dr. Eric Bush. Some of you who've worked on swine studies before might know Eric from, he is our swine commodity expert in NAHMS, and he has run the, how many swine studies have you run, Eric? A few. 2006, 2012? Okay, so you've run 3 of them at least. Okay, so Eric is pretty well versed in most of the operations of any of these studies, and so he is available for any questions you might have here this morning. And as we move forward with this study, we will be responding to any questions you have and working with Eric on some of the specifics. Also, for those of you who are on Tuesday, Dr. Chuck Fossler is with us again. He has been involved in survey development for this study as well as the beef study. He was integral to that, and Chuck will be with us for probably another 20 minutes or so. If you have any questions, please feel free to jump in here. I think Bill will be with us another 20 minutes or so if you have questions for the confidentiality process in 60 and so forth. Okay, so moving forward, we're going to go into the swine study itself now. And as I said, there are probably 3 documents or 2 documents now that we'll be relying on fairly heavily, and that is the swine, the manual that has both the beef study information in it as well as the swine study. And then also the questionnaire. It would be good to have that on hand. Okay, so the objectives of our study is to describe the antimicrobial use practices at a national level in feed and water on production sites with 1,000 or more weaned market pigs, to estimate the percentage of sites administering and the percentage of weaned market pigs receiving specific antimicrobials in feed and or water by reasons for use, to establish baseline or benchmark data and antimicrobial use practices for calendar year 2016. And this is related to the Veterinary Feed Directive, as I mentioned, that was promulgated by the U.S. FDA and implemented on January 1st of 2017. I think we use these terms baseline and benchmark when you're talking with producers. Some of us use baseline, some of us use benchmark, and part of the reason that we are flexible on that is because when we've talked with producers and used the word baseline, some of them tell us that this has been something, a process that's been in place for 10 or 20 years, that they're changing use of antibiotics and their response to antimicrobial resistance, and that we actually cannot form a true baseline use because these trends, these changes have been occurring over time. So if they mention that to you, then you're free to say that we are establishing a benchmark in the process for evaluating trends over time. But either one of those terms is certainly acceptable. And again, we're going to be describing antimicrobial stewardship practices on production sites. So the specifications of the swine study is here. It's 1,000. We're trying to make reference to 1,000 or more weaned pigs. That's our population of interest. We are doing this in 13 states, and those are listed there. This these 13 states account for 93% of the operations and 92% of the inventory on operations for the sites with 1,000 or more pigs. And the operations in these 13 states account for 88% of the total U.S. pig inventory. So we are covering the vast majority of the inventory and operations of swine sites and animals in the country. As you might recall, for non-sites, we try to achieve coverage, a representation of 70% or more of sites and inventory, and so we, with this study, we are aiming higher at 80 and 90%. And we've chosen operations and sites with nursery or grower finisher pigs because the majority of antimicrobial usage is in these types of pigs. We're going to go into a bit of the what's happened before with the NAHMS enumerators before you are in touch with the producers. So beginning in May, NAHMS enumerators visited operations and conducted a survey called the NAHMS Site Selection for Swine Operations Questionnaire 2017. And the reason we've had to request NAHMS to go out and conduct a survey is so that they could actually do a random selection of sites from the operations. The NAHMS list frame contains data and contact information at the operation level and sometimes at the site level, and so we have had to work with them to request that they actually, when they contact an operation that has multiple sites that are part of the operation, that they randomly select from those sites in order for you to get the information on those sites to actually do the site visit. And so this site selection questionnaire was conducted, and I believe is continuing to be conducted through June. What's the last day that they'll be doing that? Do you remember? I think it's
June 30 for everybody except the upper Midwest, and they're going to go to the 7th of July, I believe.
Yeah. So these site selections with turnover information are continuing now and will continue through first part of July. So in the case of swine, you can expect to see this, the turnover still occurring over time. And then they will be completing the consent forms at these visits. So when you go out to conduct a site visit and a survey, these are the materials that we recommend that you have with you. The manual, as I've said, that is available on the SharePoint site. We strongly recommend that, just like with the beef study, that you spend some time reading and studying this prior to the visit. There are launch sheets, and those are available on the SharePoint site. Those launch sheets contain the objectives and some background information and maps and more information on SIPC. So the launch sheets are very informative, that you can leave that with the producer because they are the information sheets that we're using for the study. So please feel free to take those and leave those with producers. The confidentiality pledge is just what Bill went over, and so you will need that. You'll need to leave a copy with the participants and then send one copy to the study coordinator. You'll also need the questionnaire, and that is the Veterinary Services Antibiotic Use Questionnaire for Weaned Market Pigs 2017. And finally, you have all of this available to you at the coordinator page on the SharePoint site. So just like with the beef study, I'm going to go over some slides, a bit of an overview of what's within the questionnaire and some guidelines for doing the data collection. Some of this you've heard before, not just from the beef talk on Tuesday, but also from Bill a few minutes ago. We just want to reinforce all of this. So the main topics within the questionnaire are sections on the inventory of the animals, the main section for antimicrobial use, which is feed and water use of antibiotics in nursery and grower-finisher pigs. And then a large section on stewardship of antimicrobials, similar to what the beef study has. We have a section on that. So the data collection on this is very similar to the Swine 2012 national study. So as we go through our data analysis, we'll be looking at data points, aggregated data from the Swine 2012 study, and being able to do some comparisons. As Bill noted, that the program is voluntary. Participation is not required. We are very appreciative of every producer who enrolls, and we want to ensure that they know that not only is it voluntary, but we are appreciative. So if you can express that to them, we would appreciate that here. We need as high a response rate as we can get, and so we do want them to feel comfortable while you are working with them, and that their data are all protected. So regarding this, if the participant declines to respond to a question, please note this and then continue to the next question. If an answer seems unusual or the quality of the data is questionable, we can record the data and then by writing a comment adjacent to the question. Please feel free to write any comments that are pertinent to the study on the questionnaire. We will be looking at all of those through the data entry and validation process. And if it's something that you feel that we need to know, then we want to know that. So please feel free to write your objective and subjective information there. I also want to point out that in the manual there is a section of definitions that's in the beef section. It's on page 49. Those definitions also apply to the swine section, so please refer to those if you have any questions. We don't talk about the metaphylaxis and group treatment in the swine section, but we do in the beef section, so that part would not quite be relevant to the beef section. So when you're conducting the questionnaire, we recommend that you have allow the producer to have on hand the records, medical records, treatment records, any antibiotics in feed, any of those records on hand. And you can talk with them during the introductory phone call, emphasize that having those treatment or other records will help this process be more efficient for the data collection. And if they have those records, and if you have time, please allow them to refer to those records as they respond. That is probably the gold standard for us, is to be able to see those records. If a producer reports the number 0, then we record the number 0. We don't just record don't know. So please be aware of that. The last 2 pages of the questionnaire contain the approved lists of antibiotics for swine in water and feed. So when you begin your survey, you can actually tear these pages off. You can offer them to the producer or respondent as a reference. And those would be the same antibiotics that are contained in the data tables within the questionnaire. We would like you to return the completed questionnaire to your field coordinator within 3 working days of the interview or the completion of the survey. If the data are not available at the time of the interview and the participant offers to provide them later, it is okay for you to accept them later. The quality of the data are very important, so if they are willing to go and find more precise information or more accurate information, we would like to have that. So once you get the final data, then if you could complete the survey and then manage your field coordinator, that would be great. If a respondent declines to participate entirely, if you would complete the office use only section at the back of the questionnaire and return that page to the field coordinator, we would appreciate that. And I'm going to reiterate the the information that Bill said about adding comments onto the questionnaire. It is okay to write comments on the questionnaire, but please use caution. Be sure there is no personal identifying information recorded on the questionnaire that's forwarded to SIA. The only information that we want that has any identifying information would be the NAHMS ID. We'd like that NAHMS ID recorded on every page. In the event that the pages are separated, we'll be able to recompile a questionnaire. Just a note about the data that we're collecting. We are collecting data only for the second half of calendar year 2016, and that is July 1st through December 31st of the year. And then we'll effectively be extrapolating that to the full year. This is different from the beef study where we collected data for the entire year. And then the other thing that we're doing here is collecting information on the people and their roles who are contributing to the response. And we have these noted in the questionnaires that for sections A through C, a respondent knowledgeable about day-to-day care and health of the pigs may be the best ones to respond, but for section B, the best person to respond would have more of an understanding of site management protocols. So as you go through your questionnaire, you will see, and we'll go over those points here in more detail, but when you contact the respondent, you might mention that these are the folks that would probably be best to respond to the questionnaire. So we will go into some questionnaire detail. I thought I'd wait for a few seconds and see if anybody has any questions at this point. I don't know if any questions are coming through across the phone or through the webinar, but I'm going to just wait a few seconds and check in with our moderator on that section.
I'm seeing no incoming verbal questions at this time. If you have a verbal question, please press #2 on your telephone keypad. But we did have one written question.
Can we see it? And Abby, have you responded to that?
Yeah, it's not really. It's not. It doesn't need to be recorded.
Okay. That sounds good. Okay. So we'll go on then into the questionnaire itself, the cover sheet information. For those of you who are participating in both the beef and swine surveys, this will be a little bit different from the beef survey. In this case, as I said, the NAHMS enumerators have been at operations doing random site selection, and they have completed the questionnaire form, the site selection questionnaire form. And so you should be getting this cover sheet information from that process. And on that cover sheet, you will see the site selection has a questionnaire has a 2-digit FIPS code for the state where the site is located. It has an operation number, which is a 4-digit number assigned by NAHMS. And then we are asking you to look into that site selection questionnaire. There is a table, question 5, that actually has the sites that were selected. So if you go into table 5 of that site selection questionnaire, you will see on the far left side of the table the number of sites selected. Then you'll see the site name or identifier. There's contact information, phone contacts, and so forth. So we would want you to create a NAHMS ID or a farm ID, which is actually an 8-digit number that combines the state, the operation, and the site numbers into one number. So for an example, when you get the site selection questionnaire, you will see from the earlier sheet, I'm going to go back now, you'll see that the state code was 17, the operation number was 0123, and the site name or identifier was claim site number 1 for site number 1, and so we move that forward and we fill out the cover sheet information with the NAHMS ID, which is now 8 digits. Again, this is different from the beef survey. So this number would be the state ID 17, the operation ID 0123, and then the 2-digit site number would be 01 because that was the first one that was identified in the random selection process. Again, this is a little more complex than the beef study, and we are not looking to have that information from that site selection survey forwarded to us at NAHMS, to be clear. That contains the site information and contact information, and so that will stay with you, just as the other contact information would, and be destroyed as Bill described earlier. Okay, moving on then. So we are now, if you're following along with your survey, we are now on page 2, which is site, or section A, site inventory. And if you're following in the manual, want to get you caught up on the manual, we've just covered page 24, and we're moving into page 26. Okay. So our site selection, or I'm sorry, our site inventory on section A, question 1 is we're asking you to record the number of pigs on the site on December 1st of 2016. And we are asking you to record it by categories. The most important numbers in this site inventory are in 1E and 1F. These are the focus of the survey, are the weaned market hogs under 60 pounds and the market hogs 60 pounds and over. In item F, you'll see that we are asking about cull cows. Obviously, that's a typo, and that should be cull sows. We would like to do a call out to one of our reviewers in Minnesota who picked that up for us. We are all kind of looking at each other when we were notified that there was a cull cow comment, that we were wondering why we didn't see that. So please make that correction on your questionnaire. That should be cull sows. Okay. So the site inventory data are collected here. Again, remember to put your NAHMS ID on each of these pages. So now we go into section B. Section B is actually the section where we collect antimicrobial use data on nursery-age pigs. And we have a definition of nursery-age pigs there at the top. Nursery-age pigs are those that are weaned and are under 60 pounds. They can be housed in either a nursery unit or a wean to finish unit, or some folks will call it a nursery phase or a wean to finish phase. So we're asking from July 1st through December 31st of 2016, how many pigs entered the nursery phase on this site? If that is 0, you want to skip to question 4. Then we go into question 2, and we're looking at mortality. Of the pigs that entered the nursery phase in item 1, how many died while in the nursery phase prior to December 31st? And then in question 3, we're looking for, in days, what was the average age of the pigs when they entered the nursery phase and when they left the nursery phase. Moving on to question 4, from July 1st through December 31st, how many nursery-age pigs entered a wean to finish phase on this site? And then 5 and 6, of the pigs that entered the wean to finish phase, how many died? And again, we're asking questions about average age when they entered the wean to finish and left the wean to finish phase. Okay, so what we're doing there is we're separating those questions 1 through 3 for the nursery phase, and 4, 5, 6 are for the wean to finish phase. Are there any questions on that that in particular Eric might be able to answer for you on those 2 different phases? Okay. So then question 7 on the questionnaire actually is the question adding the numbers of questions 1 through 4. Then, so you have to sum those, okay, for the total inventory. Okay, so question 8, we're moving on to question 8 about use of antibiotics in water for any reason to nursery-age pigs. And if this is no, if they did not administer any antibiotics by water for any reason to nursery-age pigs, then you can skip this section and go on to question 11. So for this question, question 9 is actually the table for entering the data, but as we look at the primary reason codes for question 9, you see that we are asking for use for prevention, control, or treatment of pneumonia, of bacterial enteritis, dysentery, ileitis, or other enteric diseases, atrophic rhinitis, and cervical lymphadenitis, meningitis, polystiositis, and arthritis. So those are the conditions that we are specifically asking about. But question or primary reason code 6 does contain an open-ended question for other disease prevention, control, or treatment other conditions. And if they are using these for other reasons, we would ask you to write that information in there. And then moving down, question 9, you can see that we have asked we have 3 columns of data that we're collecting. Again, we refer back to the primary reason code 1 through 6 from the table above. Then we're asking about the percent of nursery pigs from section B, question 7, that we just summed, that received this product during 2016. And that should be the last 6 months of 2016, to be clear, because all of our data are for the last 6 months. And then finally, the total days that these drugs were administered in water for each group. Okay, and you can see that the ingredients that are the trade names that are listed there are also the ones that are at the very back page of the questionnaire, and that is page 18. Those should look the same. And so we have all of the trade names listed there and the active ingredients in case they have any questions about the medications. You should help them, direct them to the trade names or the ingredients that they might have questions about. Okay. So moving on to the respondents, the person who responded to this question, this is question 10, and that is who among the following contributed to completing question 9? And we have a list here of folks that the role the person may fit into. If none of these apply, we would like you to write in the actual role in question 10. That the final option there is to specify the other role and write that in. So we want that information as well. You'll see that same question repeated in sections B and C for each of these tables. So if they do change over time, we would like you to specify that, okay? Okay, so we're moving on to antimicrobials in feed. And so on page 4 of the survey, question 11, the reference question is from July 1st through December 31st of 2016, were any antibiotics given by feed to nursery-age pigs? And so for this, we have primary reason codes in the table at the top of page 5. And again, we are looking for prevention, control, or treatment of a similar list of diseases That would be bacterial pneumonia, enteritis, dysentery, ileitis, other enteric diseases, atrophic rhinitis, cervical lymphadenitis. Those are similar to what we asked in the previous question, but now you'll see that primary reason code 5 is an increased rate of gain and improved feed efficiency, which is a production use of an antibiotic for growth promotion. This is where we might see the greatest change over time because the growth promotion uses of antibiotics are one of the primary, the medically important antibiotics, I should say, are one of the primary targets by FDA for change. And so there are no approved growth promotion antibiotics to be administered in water, only in feed. And so this is the place where we might see the most change. And then for number 6, other disease prevention, control, or treatment. So Table 12 for antibiotics given in feed to nursery-age pigs. We have the definition again of entering the data, entering the phase, and then the reason given. Now we have 4 columns that need to be completed. Again, the primary reason code from above, the percent of pigs from Section B, Question 7, that received the product during the latter half of 2016. Again, that's July 1st through December 31st of 2016. And that's stated in the text for Question 12. So in case you have any questions, please refer back to the descriptive text above the table. The average age of pigs in days when the product was first added to feed, and the total days in feed per group. So these are pretty specific requests. You might need to spend some time with the producer to see if they have this specific information available and how to tease that out of their records. But this is actually important for measuring duration and uses of antibiotics. I'm going to put another footnote in here regarding the use of duration of antibiotics. Again, as we mentioned on Tuesday, that the FDA in September, I think they actually posted a Federal Register notice about collecting data on the duration of use, and so producers are a little bit sensitive about providing this information on duration of use because they might be concerned that that this information will be used in a more regulatory format than they would prefer. Again, we tell them 2 things on this. First of all, their data are completely confidential and protected, and they will not be released in any way beyond the aggregate. And secondly, that USDA is not a regulatory agency. There will be no regulatory efforts after we collect these data, so that it is okay to release that data. But thirdly, if they just decline, if we politely decline, we can certainly make a note of that, but they prefer not to answer that question.
Hey, Kathy, we had a question. So in filling out these, like for question 9, do you want a number in every box? So do you want a 0 indicating that something is not being used, or do they leave it blank? How do you want these filled out?
Well, I think in the past I'm going to refer to Eric here and see what kind of data he saw when he got these tables in the Swine 2012. What was the most informative for you when you were analyzing and validating the data?
They only put a primary reason code in for the antibiotics that are being used. So
that's blank. Okay. Did you all hear that? That if it wasn't used, then just leave it blank. Don't add any zeros and no lines or anything. Blank is okay. Good. Okay, so let's go on. That was antibiotics in feed, and again, the next question after completing the table of question 12 is who contributed to answering question 12, and the same group of, the same selection is there, check 1, or I'm sorry, this is a check all that apply on questions 10 and 13. Okay.
Do you want to take a break before you go into the section?
Yes, I think I do. My throat's getting a bit dry.
Yeah, I thought maybe, so. Okay, Marvin, we're going to go ahead and take a 15-minute break now.
All right.
So I think if everybody could be back by 10:30, that would be super.